My name is Jason Wolstenholm, the chiropractor at Move Well Spine and Sport. I've had this practice for about 10 years. Along the way, I've been competing in CrossFit, both kind of at a recreational level and at a competitive level. Along the way, I've had my share of injuries, but always tried to keep myself in shape and moving well. I move all day around the table working on people, so I appreciate a good chance to sit, but I know a lot of people have to sit all the time, so I wanted to take this opportunity to develop some exercises around the QOR 360 chair and hopefully share that with all you guys to be able to show your patients and maybe your staff and you yourself. So the introduction to the QOR4 exercises. The purpose of these are to get you moving throughout the day, activating those little spinal stabilizing muscles while you're at your desk and working. And it's kind of hard to do 3 sets of 10 of anything that's going to fix 8 hours or 10 hours of doing the same thing. So what we've recommended to people and works really well is to anchor these exercises to something that you're already doing. So before you even sit down in the morning, you'll approach your chair with a purpose, you'll go through a little bit of a warm-up, go through the 4 exercises, and then we're going to talk about how to find that neutral position and where you should be balancing on the chair. Again, you'll do that maybe after lunch and then in an afternoon break or something like that, but anchoring it to something you're already doing. You come back from lunch, you go through your warm-up, do the 4 exercises, the 4 movements. Anywhere between 2 and 5 times a day would be a good frequency, and we will stress quality over quantity. So it's not good to do anything for a long stretch of time. So standing still at a desk, not a great thing. Sitting in one position and not moving, not great either. So we're going to stress a lot of changing a position too. So getting started, you'll stand, feet flat on the floor, and you're just going to reach overhead, taking a deep breath in. Exhale through your mouth, blow all your air out, and just repeat that a couple times. Okay, so the second movement for getting ready is simply a squat. So this is the full range of motion, and we know a lot of people can't do this right away, but it's the goal. So with your feet about shoulder width apart, keeping your heels on the ground, you're just going to squat all the way down, hold this position for anywhere between 10 and 20 seconds, and then come back up. From the side, here, squatting down, trying to keep your chest up and feet flat on the ground, and then coming up. And one of the best assisted ways to do this is to hold on to a doorway, make sure you have enough room behind you, and start to sit down and back like you're trying to sit on your heels. And just go as deeply as you can comfortably without pain, which may be here, but using the assist, you should be able to lower yourself down a little bit more comfortably and use that to pull yourself back up. So the proper setup in getting started here, you want to set your chair height so that your hips are slightly above the knees. And the cool thing about the QOR chairs is that there's a huge range that we could have between that starting position and up to almost like a half standing position. We're going to work in an ideal sitting position, which is with the hips slightly above the knee, feet flat on the floor. Okay? My sit bones are centered on the seat so that I can rock in all directions. At first, it's going to feel you don't have quite the control you need to, and over time it should feel very stable. The first exercise starts with slumping forward and fully extending. The points to think about here when you slump forward are to really just let everything go. Let your knees drop in, your shoulders roll forward, and your back and your neck slump forward. The correction here then, in the next movement in the exercise, is to come up very tall, let your knees drop out, reaching tall to the ceiling from the back of your head. That's going to pull you up, let the hips rock forward, and then you'll set your shoulders. So you'll light shrug, bring them back, and let them slide down. This is going to be the set position if you're working on a keyboard or a mouse, is to have the shoulders down and back. So highlights of using the QOR 360 chair for this are that it really allows that full extension of the low back and that full flexion. So when you're doing the slump and rounding, that chair allows you to really flex by dropping back, and then when I come into extension, the chair moves and allows me to really overextend through here. Remember, do this all within a pain-free range of motion. So if you're getting a pinch here or any kind of symptoms here, that's a little too far. The idea is to then find that center where you're perfectly balanced on your sit bones, and that's going to be that ideal active sitting position. Okay, the second exercise is going to be the hip drop, and this is a lateral movement. So your first movement was forward and backward, and now you should be able to find the center of the chair where you're balanced. From that centered position with your core engaged, you're going to drop one hip down to the side. So I'll drop my right hip down, feet stay flat on the floor. You can use your desk for balance when you first get started because it starts to feel a little loose to do these exercises. You can drop down, feel a little bit of a stretch, come back to center, over to the other side. The idea when you're doing this is to not lose that center balance position, so you're getting just a lateral movement in, or the other side, lateral movement there. You can advance this by really getting a stretch through that side and reaching overhead, dropping the hip and stretching down through here and coming back up. You can go both arms overhead, make it a little bit more challenging, coming back to center. Okay, so the third movement is called the active twist. The active twist starts with that same position of finding neutral spine, balanced on your sit bones. You're going to turn to one side, rotating back. I'm going to sit tall through this movement, and then the twist part comes into the breathing assist. So we're going to breathe in. As you exhale, you're using your abdominal muscles to twist your upper body further around. You'll take a breath in, exhale, go a little bit further. When you inhale, back off, exhale, twist a little bit further. I'm using my hand to gently assist me here. I'm trying not to overstretch or drop off of my center position. So the idea is to maintain that active sitting position, active core, and then engage some muscles to challenge you in rotation. Again, this fourth movement is the marching movement. This is probably the most difficult of the four movements. And it's good to have an assist when you're learning this one. And if you're at your desk, that makes a pretty stable surface to use. Or you can use one of these, and this is probably the best use for this device, is to hold on to for balance. So you'll find your centered position on the chair, feet flat on the floor, and holding on to your traditional chair on the back will give you that support. I find that neutral spot. I really brace and tighten through here, through my pelvic floor. We haven't talked about that, but your core is made up of all of the muscles through this whole region. We're going to engage that, and then this marching movement is just trying to lift one foot off the ground without letting the chair move. So we're really going to brace, and I'm going to shift my weight, my tension into my right leg first, and I'm going to try to lift my left leg without letting the chair move. And then come down, we'll switch into the other side. So I find that core, that bracing, tension through the left leg, brace the abs, and lift the other foot. We call this the march because you can just alternate one foot, find that brace, lift the other foot. It's really easy to say you want to do your 10 steps and go for quantity and just march, and this is not the correct movement. Trying to hold that core neutral, engaged, lift, lift. And as you improve, you can take away the chair or your desk, have your hands out in front, and try to lift that foot. If you can't lift the foot without the chair moving, just transferring the weight from one foot to the other is a really important part of the exercise. It's recruiting all the little stabilizers in here to eventually progress you to being able to march and not have the chair move. Also wanted to stress that you should get up out of the chair often. Most people will start to fidget and need to move around, and that's ideal. You're listening to your body. If you have a variable height workstation, that's good too. You can pull it up, you can stand for a little while, come back down to sitting. The QOR 360 chairs have that adjustable height. They have the option for the adjustable height, so you could vary your sitting position throughout the day. Going through the 4 exercises for sets and reps, the slumping to sitting tall, you'll want to do that about 3 repetitions, focusing on getting that full range of extension and flexion, taking the 2 good breaths with each repetition. The second movement being the hip drops. Once you found your neutral position, you'll do 5 per side, so dropping to one side and then the other. We'll do that 5 times. The third movement is the active twist. So that one's a little bit more challenging. It involves a lot of musculature, so anywhere between 1 and 3 repetitions per side is ideal. Again, quality over quantity. The fourth movement, that marching, that may just be 1 attempt per side to start out. Take a break, stand up, move around, come back to the chair, re-engage. You're looking to be able to repeat 10 steps without losing that core control. When you can do that, you don't need to keep increasing the sets, the repetitions. Just make that part of your everyday routine. These can be done every day, and they should be. If you're experiencing pain, discomfort, especially anything that comes into the glutes or down into the legs, you'll definitely want to talk to your doctor about that and maybe change position or have another option for sitting. Again, any one thing done all day is too much. So we just want to take a minute to talk about anatomy, posture, and active sitting and what's happening. Your spine has some natural curves in it, in your neck, in your mid-back, and your low back, and it's when talking about the core, we often just think about the abdominal muscles and this low back region, but active sitting and using the QOR 360 engages every muscle in the body. It's how your brain balances your body in space. So having your spine and your posture be in the correct anatomical position allows all of those little muscles to fire correctly and not overload the bigger, more powerful muscles. So in your neck, you should have a gradual curve here, one here, and a nice neutral curve here, not too far flexed, and not too far extended or too far flexed. So neutral spine is right in the middle of the two. Hyperextension comes here when your core is not engaged. Too much flexion happens here when you don't have that control or that proprioception. Sitting and doing active sitting, especially from a neutral spine, activates all the little muscles and gives you a better awareness of where your body is in space versus sitting in a chair slumped and hanging out on your spine like this all day. The injury doesn't necessarily happen there, but it happens when you go and do something after doing that, sitting like that all day. Some of the ways that the chair can help you, or so that you can see how it's affecting your spine. When the chair tips forward, it's taking you through this full extension anterior tilt of the pelvis, mobilizing, lubricating these joints, getting all of the little muscles active and woken up. When the chair tips backwards, it's allowing you to drop into a little bit of flexion, again, to take those joints through a full range of motion, waking up the muscles. When you find that neutral position where you're balanced on these sit bones, your head and spine should be balanced right over that sit position, almost like you're balancing and there's a little bit of a wobble and you just feel little muscles holding your posture. That's the goal, that's what we're trying to achieve. The QOR4 exercises start to train those balancing proprioceptive muscles so that your body's more aware throughout the day where it is in space and not overloading your joints, your discs in the front with too much pressure.